I'm Dr. Davis with UT Health East Texas Pediatrics. Here are the top 5 things you need to know about ADHD. ADHD in long form is attention deficit hyperactivity disorder. What that means, if we kind of take the medical jargon out of it, is it's difficulties with executive function. So those are things like time management, working memory, sometimes even things like object permanence, which is remembering where something is after you can't see it anymore. We first tend to see it right as we're heading into school age. Most hyperactive impulsive kids get picked up around preschool, kindergarten, first grade. The other kids, the inattentive subtype kids, we tend to pick up more like middle school, high school, college, career, and beyond, usually when the demands exceed the ability to compensate. Signs of hyperactive impulsive ADHD. These are things like the kid who's constantly on the go. It doesn't matter what you do, they're constantly moving, constantly doing something. The minute something gets boring, they have to do something else. That's not necessarily because of an energy level, but just because the brain needs to be stimulated to keep doing something. The inattentive kids, they're the ones, signs that you're watching for is a lot of times anxiety. You might not necessarily notice that they're dealing with ADHD. You might notice that as they're going through school, they're a little bit more anxious about schoolwork. And one of the hallmarks sometimes is the 9-month project that you do 3 nights before. It is a neurodevelopmental difference or disorder. What we have found is that medications do help. And mostly they're stimulant-based medications. So stimulants are our main mode of treatment. And then at home, we can also kind of work on behaviors. So we can set up things like, if a kid is very bad with time awareness and they're very what we call time blind. Having timers and clocks in different places so they can see the progression of time and having frequent reminders can be helpful. So we have 3 specific classifications based off of the behavior profile that a kid or adult is showing. So you have your predominantly hyperactive impulsive, your predominantly inattentive, or your combined. And to meet those criteria, you have to essentially meet a certain threshold number of symptoms. For kids, it's 6 out of 9. For adults, it's 5 out of 9. In either of those 2 categories or both to get that kind of designation.